Good evening, all of you who have joined for this very unique session, a webinar series to improve the healthcare access for transgender and sexual minorities. It's organized for the doctors and by the doctors. It's organized by the IRIA Kerala's Shakti, Reksha and Social Wings in association with IMA Kerala and Center for Advanced Research in Health and Human Behavior, CARB. So this is a series of lectures on different aspects on how to improve the healthcare access for transgender and sexual minorities. First of all, the doctors have to be more sensitized into this subject. Similarly, the healthcare institutions also has to be more sensitized into this particular aspect, particular subject. Today, for this, in the inaugural session, we have Dr. S.K. Harikumar to give us a talk on gender and sexuality. To introduce the speaker, let me invite the Vice President of IRIA Kerala, Dr. Rajesh MG, to give the credentials of the speaker and invite him to give the talk. Over to you, Dr. Rajesh.
Good evening, everybody. I'm Dr. Rajesh. Thank you, Dr. Rijo, for the introduction. And first of all, let me congratulate Dr. Rijo and Dr. Ramesh and others who are behind this program, who have made this session possible, because I think it is a need of the times through which we are going on. And I am very happy to introduce Dr. Harikumar, Dr. S.K. Harikumar, who is the CEO of CARB, which is a familiar name now in these circles. He is a medical professional with 35 years of professional expertise in health program administration, management, capacity building, strategy planning, you name it. His core area of interest is behavior medicine. He handles technical issues related to behavior, sexuality, gender, mental health, and partnership building. All these are core issues in which he focuses currently. His expertise in medical treatment, medical teaching, research, and capacity building has given him wide perspectives to speculate health programs. He is involved in several of those academic and professional organizations, both under government and NGO. He is also involved in strategic planning in several healthcare programs, and that is one of his core professional strengths. And that is why we are very happy to have the apt person here. He has worked in Kerala National AIDS Control Program, the NACP in the state, and he was under his eminent leadership, which resulted in a unique partnership initiatives in the state by different PRIs in NACP. Currently, he is the head of technical support unit of Kerala State AIDS Control Society, and is also a technical consultant to the KUHAS, that is Kerala University of Health Sciences, Thrissur, and also a consultant at the Child Development Center, CDC, Government of Kerala, Trivandrum. A very warm welcome to you, sir. And this is the ideal start for a week-long program, and I hope doctors get sensitized to this, because we even as a radiologist, we come across such patients very rarely, and their issues are different. There is a problem of lack of awareness even among doctors, because it was not much of part of our curriculum during our MBBS years. Maybe that is why we are not familiar with this field, but that is not the way. And I hope this is going to be bring about that much needed change. Welcome, sir.
Thank you. Thank you, Dr. Rajesh, for the nice introduction, and Dr. Vijo, Soumya, and other IRA colleagues. First of all, I should appreciate you for selecting this topic, actually a series of topics, which is definitely going to enrich the healthcare community, as well as giving an opportunity bring this actually try to actually introduce the topic in two perspectives. One is actually taking our medical profession, the medical doctors, to these issues to speculate it with clarity and understand it simply, so that whenever we come across our patients, our clients or patients, we'll be better skilled in discharging our responsibilities the way it will be more helpful and appreciable to them. And the second perspective is actually bringing the individuals belonging to sexual minority groups or like transgenders and other LGBTQI, which I'll explain, to come to us with more confidence, because we people are clear about their needs, their peculiarities, and the issues which they are dealing with. So, as our Dr. Rajesh was telling, actually we are into this HIV program and also to the gender and sexuality and behavior related research, where we come across many such issues, both in terms of studies and in terms of issues of people which we deal with. And so I'm not going to address every slide like that, because most of the things are explanatory. So I'm trying to introduce what is sex, what is sexuality, and what is behavior. Sorry, what is gender. And sex, as we all know, is the physiological differences between male and female, and it is presented, it is visible as the primary and secondary sexual characters. And only one thing which I would like to say, I know it has got a very strong biological basis. And there is a small, very small segment of population who are born intersex, which are reflected in the group of the sexual minority group, which we are going to discuss again. Sexuality, this becomes the sum total of the thinking process, the interest, the thought, the attitudes, everything related to sex-related matters for a person's comfort, a person's expressive desires, everything is included in sexuality. And in gender, which is a different thing, which is actually the behavioral. But when we say that sex is biological and gender is behavioral, where the gender expression against the expectation, we should say. And this is something which has been gradually become a choice of the person. That in an adult life, a person selects, should have the freedom to select the gender. So these are this is the transgenders and all this are the transgender population outcome under this context. So these two areas, which I'm just giving some of the areas like sexuality and gender. There are some points which we should always remember, because we should see it. You should think that actually when a person comes to us, what are the things we should understand with respect to sexuality and also gender, which will be going to be helpful for them, and it is going to be easy for us to discharge the responsibilities which are expected of us. And what are the determinants? You have the cultural factors, political, legal, philosophical, moral factors, and all. And to end up with the thing, we have a lot of subjective dimensions of a person which reflects in the sexuality and gender also. We have things like that. So these are it's called the four strands of sexuality. You have what is called the sexual desire or attraction. You have what is called the sexual activity or behavior. All those things are very common, because if the words are in a group of doctors, I need not go much in for the explanation, because all these things are meant for postgraduates in social sciences who are going to deal with the issues. And sexual identity. This is one thing which the identity is actually whether you're going to be a heterosexual, bisexual, homosexual, which is one part of the interlinked strand, and the experiences. So if we see these four dimensions, it is these four dimensions which finally decides what a person is, how a person is placed with respect to sexuality in terms of his views, values, desires, and all things like that. And this is the background. When we are going to see a person with some issues, some support requirement. So if we are able to effectively explore these areas, many interesting clues you will be able to get, which is going to help your diagnosis as well as the support which we are going to provide to the person. So regarding the sexual orientation, these are the 4 things which again does not require much explanation. You have heterosexual, where the preferred sexual partner is coming from should always be from the opposite gender, whereas the homosexual should always be from the same gender. Bisexual is one who considers both genders, the complementary gender as well as the same gender, as equally attractive as a partner. And you have asexual population, which is a very small population. This is different than that intersex, which I was explaining earlier. So asexual is a person, a group of people who are not having any interest on sexual encounters with any individuals of any gender. So this is actually this is a complete picture of the sexual orientation. And the solitary sexual practice we all discuss about, especially in the adolescent age group. Actually, this is a concern to many parents and we all know that it is not going to be a very serious thing, but still there are issues which come out of it. So the issues like pornographic material, the use of pornographic materials, and also this what is called the compulsive masturbation syndrome and the masturbation anxiety. These are the only 3 dimensions, issues or 3 categories of problems which at times require some professional support to be extended to the person. Apart from that, this is not going to be of any problem to any person. So I'm trying to give the classification on both gender and sexuality. We already discussed about the sexuality part. So let us consider the gender part. In gender also we have the class. So we should always see that these 2 are separate. But when you converge to a person, both the issues or both the classification will be relevant to the person. So when you, for example, if you are going to identify a person, actually describe a person in both the dimensions, you have to say a person is cisgender and heterosexual, or cisgender and homosexual, like that. And I'll explain. Cisgender men and women. Cisgender is the category where a born boy is going to be accepting and growing and or living comfortably, confidently as a man, and a girl which is born is going to comfortably and confidently living as a woman. So this is the cisgender, which is the majority and as per the expectation of the civil society. And transgender is the other side, like a girl who is born would like to accept the gender of a man, or a boy who is there when he is growing to want to accept the gender of a woman. So gender in this context is actually the emotional dimension, the thinking, what I had to, how I process my thoughts, how I comprehend, how I like to get considered by the other people. All these things are going to be the gender per se, which is going to be the factor. Pure and gender fluid persons, actually the type of people where this whether it is going to be solid like transgender or this cisgender, there is some ambiguity, some confusion is there. At some point they feel like cisgender and some point transgender, because related to the situational and also the people or the group with which they interact. So it's a very interesting thing, and this is so. I'm telling you that this is the concept, or this is the context which these people would like us, the healthcare providers, to properly understand, at least when they are going to explain it. See, maybe it is not very easy to just look at a person and understand these issues are there. But when they are going to explain, we should be able to digest it. We should be able to accept it, comprehend it properly. and reciprocate it in that way. And transsexual men and women are people who are actually this transgender population who has selected to do or opted to do the surgical correction, the medical correction of their body structure to suit to the gender to which they are. Like, for example, when a man wants to become a woman, the removal of penis and construction of vagina and construction of breasts. So this is the transsexual population. Sexual orientation, I explained. We have heterosexual men and women. Homosexual is called gay population, and the lesbian population, and the bisexual population. So this can happen in. So this is one concept which, if a doctor, if a person comes to you, he is going to explain a difficulty to you. If you give an impression to him that you are a person who is able to understand it, comprehend it, and reciprocate it properly, a lot of issues, he'll be very confident in telling you a lot of things, which maybe I'm not telling that everybody is having this need, but there is a significant number of people who are having this need where this is going to be an important skill as healthcare provider can be. So this I just, because we are interacting in the medical group, I thought that I'll bring this very interesting. It's a recent trend, this recent categorization or the typologies which are explained, like metrosexuality, retrosexuality, gastrosexuality, porno, and also sapio. So this again is not a very high demarcated thing, but we will be able to see this also as part of very interesting behavioral or the issues which people are coming to you. So a metrosexual is a fashionable heterosexual man, in like that, in an urban heterosexual fashionable man who is actually spending more time in beautification, their face and like what you can see in this thing. So it is actually this importance given to the appearance is going to be very high compared to the normal, whereas which you see the next one, retrosexual is actually a raw man, which like we have a young man who is not going to be very much concerned about all the well dressing and final touch of the dress and face or hair or anything like that. So something like a easy going man is called a retrosexual. Gastrosexual is the next one, actually very interesting, very funny thing, that the person who opts and is very skilled in using his cooking skills or the skills related to the food making thing as the mean for attracting the partner. That's called a gastrosexual. Pornosexual is actually the person is very much interested in exposing. It is not exhibitionism, actually exposing the male body to the partners or the individuals to attract the attention and also maybe as a romantic partner. And sapiosexual is a very interesting thing. Another thing which is in which actually the intelligence or the thought process, actually the two people are getting attracted, mutually worshipping their high level of intelligence or the admirable way in which they can think and all. So these are the 5 things. I'm telling that it's a very rare thing. This also very interestingly we can say that actually when there is some relationship issues which are coming to treatment, these issues may be there. If you explore it properly, if you convince them, actually your support will be more accurate to their issue, and you'll be able to yield results. This now I'm coming with all these categories. Here again, all these things are very simple, which I have already explained. Lesbian, we know, homosexual women, gay, homosexual man, bisexual. So bisexual is actually both the thing, both the this will be preferred partner will be both. Transgender, I explained. Cure. Intersex. Intersex is actually where like hermaphrodite. Actually, intersex there may be a biological basis for the chromosomal issue, which is going to be the reason for that. And asexual. So I'm just telling that actually if these are the issues, which all these things can be considered not very usual. I am not using the word abnormal, which is a wrong word to be used in this context, which is not considered to be very common. So since it is not very common, the people in coming under this category, they always feel somewhat not confident in expressing their self strongly in the situation. So that's what I was still trying to say. The thing is that actually, when you say about the sexuality, which we explained in that, actually gender, why a person, actually there's a process called gender transition. Usually it happens in the adolescent phase. So what happens is, for every one of us, every person, every individual, you need one gender base for us to think, express, enjoy, be productive, we plan things and plan our enormous growth and everything. So this gender base is going to be a very strong companion throughout your life. And when this is going to be in challenge, like in the case of transgender population and all, most of your achievements and also the opportunities are getting delayed. So that's where the transgender population is troubled in the social life, and that's what has been reflected in this directive of the Honorable Supreme Court, saying that we should be giving opportunities and we should not have any act or words to discriminate the transgender population. So coming back to the healthcare scenario, in a gender and sexuality, the expression is actually when the health complaints are going to be presented. So at times it may be having link with sexuality or gender, and they are not very confident that when it is going to be explained, it is going to be understood properly or not. Again, many of the person, like there are some transgender population who would like to express their self in the gesture and everything as the opposite gender, and this may not be appreciated in the civil settings, and some other people may laugh at them. So they are always afraid or not confident for the full expression of the self, which we all know, like we all have our specific pattern of expressing our self, which is challenged in such population. When it is going to be healthcare, because of this situation, they will not be able to properly explain everything and get the right type of treatment. Again, gender-based issue. So at some point, gender and sexuality, it will be a direct gender or sexuality related issue. And in the second context, it will be the base, the gender or sexuality base. For example, if I am a homosexual, I have in homosexual also there are two varieties, they say. Actually, it's called ego dystonic and ego syndonic. Syndonia, what is going to happen if I am a homosexual and I am an ego syndonic person, I'll be very confident and comfortable as a homosexual. My only botheration is actually why others are getting bothered about me. But if I am a ego dystonic, my dystonia, like I'll always be worried why I am like this, and this will make me very much and not confident to express things. So the barriers are coming like that. And gender transition and gender dysphoria, these are the two words we should understand. And I told you actually it is the time of gender, this adolescence, when a boy or a girl initiate the process of transition. If I am a boy, I want to become a man. Even the process of becoming a man, I may at times, even though it's a cisgender process, I may at times come across some issues, like if my mustache is as better than as my peer persons, if my chest and other things are going like gynecomastia, we all know that boys are worried about that. Girls also have the physical growth is right or wrong, right in the right proportion and things like that. So this is a gender transition, and then gender dysphoria is any type of difficulties, emotional problems and all, which are linked with the process of gender transition. So this is again one major thing which we have to consider during when you are seeing the adolescence, and also if you are going to support them in a proper way, more things will be expressed and they'll be more confident in seeking the best care which can be extended to them. So the main thing is actually many of the medical doctors, even as our Dr. Rajesh told, we don't have much. The curriculum doesn't cover adequately to teach about sexuality and gender. So when someone tells about a transgender, people say that their genitalia may be different than the heterosexual, cisgender population. It is not true. We should understand that actually the gender concept is in the emotion, in the thinking process. So with a perfect body of a man, I could be a trans woman in which my thought process, my feelings, my desires, my expectations, everything will be that of a woman, which we should understand, appreciate, and respect. Sexual minority groups or the relatively larger population, relatively smaller population in the with respect to sexuality and gender. So these are the things. One LGBTQA is lesbian, gay, bisexual, transsexual, queer, intersex, and asexual. Plus, it indicates that actually more things and the more variation of this will be there. So it is a large spectrum, and in that spectrum, like a rainbow, where you will be having combination of some of these things, which we can say may require a lot of support, and they'll be expressing it again when you are very confident. Female sex workers and male sex workers and cowgirls sports. So these are the type of people which, especially people like us who are working with the HIV program, is always interacting. They have their own issues. Even though female sex workers are heterosexual, cisgender population, but they have their own issues and all. Male sex workers, they come to the LGBT, that's a gay category, and their interest will be both will be there. Male sex workers who are catering the women also is there. So all the things are actually their sexuality, their sexual behavior has got a pattern which they think is actually different from the common large majority, and so they require support. So safe-sex behavior, this is part of the HIV program, which we are saying that actually when you are having whatever is going to be your desire and interest in sexuality, you can have the enjoyable sexuality, but you should always be doing it in a safe method. So it's called a responsible and enjoyable sexuality is the responsibility of every adult. So gender-related perspectives, some of the things which I have already explained. So the thing is that each individual perceives. Actually, when I as a person, if I am a cisgender heterosexual man, there's a pattern in which I see the world. I want to see the things going. I want to get the appreciation. I want myself to be considered by my colleague, my female colleague and male colleague. Everywhere there's an individual subjective perception, and I have an ability to perceive others' gender and sexuality. So these are the very important perspectives, which if going into conflict, it will have a lot of social issues. These are the things which is not going to have much medical issues. This is going to be more health issues. It is going to be social issues which are there. Intergender nurturing. Actually, I should be able to understand that if I'm a male, my male gender, my female counterpart will have a lot of unique things which I am not having, but which she has, and which when it is getting shared with me, when it is going to be told or explained to me, is going to support me. So this is something which this is the intergender nurturing and actually complementation. These two things. So I can complement it. I can nurture it for a woman or a man to bring their own unique interests, talents, and desires to blossom. Gender sensitization from adulthood. Actually, there are a lot of issues reported on gender violation and this ill-treating women and all, which should start from every household and in the educational places, workplaces. How beautifully you can enjoy the context of multiple genders. How that is going to strengthen your capacity of thinking and also enjoying the beauty, the life. So this again I was saying, one is actually self-perception of gender and confidence. Like if my expectation, my desire is to express my maleness, when I am having a opportunity for that, I will be very confident. And when people are expecting that alone from me, I will be very confident. That is about the perception. And the concept of comprehension. Actually, when I am told something, I am explained something, the person who is telling me should understand that I am going to comprehend it the way a man is going to do it. So that is what he or she wants, and they'll be telling it. So there are very, very clear differences. It is not that either like male or female perception or comprehension is better than the other one. Both are unique, both are beautiful, both are very strong, which others should be getting from this gender only. And views and options. Self-gender, actually, when my gender is being expressed, how it is going. See, if I am going to be a transgender, if I'm going to express a womanhood, unless it is going to be accepted by others, I find it difficult to mingle with others and be in their context. And the need for gender congruent social settings, actually, where it is going to be the workplace, education setting. So there are many cases where in the adolescent period, due to the issue of this gender dysphoria, when there is the tinge of this gender transition to the transgender thing, the person is not able to survive in that context, in the situation, because of the ill treat from the other people, and they have to stop the studies and go out. So I am not going to explain all the things. Actually, gender mainstreaming is actually bringing everything to any context. Whether it is going to be offices or realization-based training or whichever it may be. There may be every policies and the programs and also the issues available there, although the provisions which are there will be gender sensitive. Actually, for men, they'll get what they require, and for women, there will not be any discrimination. Gender blind is the opposite thing, where the person actually they are see if we are going to maintain a situation where women or men cannot come and get the what they desire or what they want, what they really want, and because of a poor understanding, it is called gender blind. Gender awareness, actually, this sort of awareness is going to be disseminated. That's gender sensitivity. So when a situation or a group is sensitive about the requirement and the presence of gender-related things, and also able to comprehend it properly and ensure inequalities, is going to be gender sensitivity. Gender equality and gender equity. Equality is actually giving the equal consideration to both, and equity is actually giving the desirable, needed things. For the men, they should be aware, they should be getting what they want, and the women, they should be getting what they want. That is a gender equity. Gender transition, I already explained. Gender dysphoria, I explained. Transgender also I explained, and transsexual, I told about this the medical, the surgical procedure or the hormonal treatment. These are the two things which is done to. It is actually the choice of the person. Only thing is actually this treatment is to be done after proper guidance, proper counseling, and actually the decision has to be owned by the person. There is a reassignment surgery which is called SRS, has got two things. The upper part, which is sort of breast reconstruction, and the lower part is vaginal reconstruction. And hormone treatment is another HT called. So pansexual or omnisexual is actually the attraction of people regardless of the sex or gender it is there. This gender I explained. Gender pure and gender fluid also I explained. Actually, gender pure is actually they are not identifying them as any one gender. There's a mix up of things. Whereas in gender fluid, at one point they are going to be. It's more like it's very well explained. Actually, masculine woman or feminine man. In a man, even though I am a man, the femininity will be dominating in me. The other way around also. It's called a gender fluid. Most of the things have been discussed already. Actually, only a couple of points which I want to explain. One is actually it is never the appearance. It is not a dressing pattern. It is actually the way in which you think. It is what is the transgender population. So we should never expect that a person who is a trans woman should dress in women attire, and also this the LGBTQIA. Each of this category has got their own uniqueness, their own needs, their own expectations, and all. We should be tolerant and also able to comprehend, listen to them with true empathy, with which we'll be able to understand them and support them the way they want. Trans men and trans women, I already explained what it is. So, critical information, some of the things like because the transgender is what we want to highlight. There are other categories also, but transgender is one group which require a lot of support at this point of time, because the Honorable Supreme Court and also the many governments, including actually our government, is actually in the forefront of giving out supportive things to the government of Kerala and government of Tamil Nadu are giving very good support to transgender population. So here,
sir, sorry for interrupting. Can you show the previous slide once again? Trans man and trans woman. Can you clarify it once more?
Yeah, trans woman is actually a boy who is born, want to transform into a woman. In the adult life, it is called so man to woman. Transfer is called trans woman. That is male to female. And trans man is actually a girl who is born, would like to live as a man. It's called a trans man. To which gender it want to go is actually shown as this one. Is it clear?
Yeah, that's clear.
Thank you. So dressing in women's attire is not universal. It is not at all needed, and TGs face a number of challenges. Like the thing is that main thing is actually each of us, we have to think and express ourselves. For that we need a gender. So in transgender population, that gender itself is challenged. It's like a person moving without a base. So that is what we should understand. If you give the base, we should appreciate that. Then they can be very productive and they can contribute a lot to the civil society, and also they can grow like that. So these are the main problems, because the last point is very important. Actually, these are the things which are the very really horrible in the past, which has changed a lot after 2014 because of the directive of Honorable Supreme Court. So we had the stigma, discrimination, unemployment. No, they were not getting employment in many places. Lack of education facilities. When they go to the places, they are not able to complete their courses. Now, many of our transgender population are completing their post-graduation or the professional courses and performing very well in the civil society. Lack of medical facilities. Actually, many of the health systems, they are not able to understand their actual issues and give the proper support. Marriage, when they want the marriage, because marriage is not like we always think of a binary gender in which male and female get married and having sexual relationships and all. There are much more. It's actually a relationship building, mutual support. All these dimensions is one which our transgender population require. Adoption, land ownership, civil entitlement. All civil entitlement also actually, as you know, now we are having many of our transgender population in Kerala. Their voters ID is in the transgender this one, and also ration cards. So these are all given by the government of Kerala. So in the economic society, they are excluded from the economic society because of many situations from the home. So wherever there is the financial or the opportunity for becoming financially strong, earnings and all, there is a barrier which is built on their unchallenged development. So this is getting changed, but still there are issues which we are seeing. And the insurance, for example, insurance. Many insurance companies are not accepting this one. But I'm sure that actually these are the things which are getting changed. Once it is getting changed, actually the health system will also respond properly. But from our side, from the medical or the health care professionals, what we have to do is we should be able to consider them the way they are and give them an impression that we are in a position, in a situation to understand them, to understand their challenges, and are determined to give support and confidence to them. So in Indian context also, we had a lot of the beliefs, there are a lot of thinking process. Actually, they have some all the religious links were there. I'm not going to all those things, but many situations they were considered a group which is to be separated from the mainstream. They were the vulgar group, and actually they used to be used for situations where begging and some deaths are happening. They'll be coming in. So there are some not very, what I say, very respectable jobs. The jobs in which their image is going to be tarnished. Such things were there, but there is a lot of difference now which is happening in the scenario. Emotional thing, actually, I was telling, we take the situation in Kerala. Kerala is a place where actually emotional challenges are a major issue. Suicides are high, alcohol use is high. So along with that, you can imagine if it is going to be a gender-related challenge also is added. This is what is faced by them. So they are actually at it's like a double-edged sword. They'll be having all these issues. So we need a counseling system, an understanding system, a support system where professionals with a proper understanding and professionalism is going to support them and bring them back to track. Health-related challenges. Main thing is actually, interestingly, recently we have interacted with a group of people, and from their responses, what they expressed mainly was actually, at least from the doctor's side, we are getting good consideration. Once we are able to explain them, they are supporting that. But the environment is not supportive. Like the hospital staff, support staff, the people who are there. So we should understand that actually we are in a broader premises where we have the responsibility of making the premises also supportive to them, which is the main concern which they are having. And also in hormone replacement therapy and sex reassignment surgery, I came to know that actually we had a discussion with our Amrita Hospital colleagues last time also. Therefore, also I had an opportunity to interact with one of the senior officials in the hospital. So there are hospitals where they are doing it well. So now we need a system to bring them to the actual places where they can be performed, and also for them to take a decision with proper guidance and sufficient time to understand the consequences. So HIV is one. That's how it is come to limelight. In HIV vulnerability, they have very high vulnerability because of the type of sex they are indulging with, anal sex and all. And in NACP 4, we found that actually the prevalence in India among the this population or transgender population was 8.82%. All these things are matters of vulnerability: violence and harassment, low self-esteem, lack of family support, frequent migration. So the thing is that they are not able, they cannot live at a place with confidence. There will be some issues and all, then they have to move to other places and all. And making income is not very easy for them. So getting arrested, criminalization, sex worker activities. Anyway, I am telling it actually all these things are still there, but the depth of these issues are much lesser compared to the earlier time. In the gender and sexuality, the healthcare situation, these are the major points we should consider. What is actually, there may be actually, when we are seeing a person, we should always be able to understand and eliminate if there's an underlying reason related to gender or sexuality in a person. And if there is any barrier which is built by the this gender or sexuality, and our attitude, if it is going to be making them go away from the situation or influencing them not to get the support taken correctly. And inadequacy in the again the concept clarity. The healthcare providers, right from the doctor, right up to the support staff, we should have clarity about what it is. So basically, we should be able to capacitate our people and explain this is what is there. And in a hospital setting, in a healthcare setting, we are expected to consider and handle it with maturity and professionalism. And providing total gender expression, we should be able to in a consulting room or in wards, they should be having opportunity to express their gender completely, and also that it should be we should expect that their sexuality and gender should not be as like the one which we are having in time as a common cisgender population. There may be differences. We should be able to perceive it correctly and complement it. So I'm trying to conclude by saying that beauty and the sense of human are well expressed when it is blended with a person's gender and sexuality. So if the healthcare providers could make them express it totally, then we'll be able to, the environment, our provided environment is good, then achieving total health will be the easy task. So this is what we can do from our side as a healthcare providers. This is what all I am telling, and if there is a interactions which we can have, we require, I'll be ready for that. Thank you.
Thank you, Dr. Harikumar sir. That was a wonderful lecture. Rajesh, are there any questions? So this is a very relevant topic that has been explained here, and one important point that Harikumar sir has rightly said, that most often doctors are more sensitive to this. A lot of effort, a lot of work still has to be done, but we are in a healthcare premise where there are other people who also needs to be sensitized, and we need to educate them and train them to understand the needs of these sexual minorities. So this is one very, very relevant point for even for the radiology departments. You need to do such an effort from our IRIA side. So thank you, Harikumar sir. Our interactions goes back with Indian Radiological and Imaging Association when during the presidentship of Dr. Mohanan, who was the Honorable Vice Chancellor of Kerala University of Health Sciences, for the Reksha program, the Saving the Girl Child project launch. Harikumar sir was the person who really helped us to do that in Trivandrum in a school there, in a girls' school there, and that program was wonderful. And that was how I came to know about Harikumar sir's initiatives in this field and the Center of Research in Health and Human Behavior. They're doing a phenomenal work. And thank you very much, Harikumar sir, for this wonderful topic. And
Rijo, we have some questions.
Yeah, please, Rajesh.
Okay. One thing is to the organizers. They want someone wants to share the list of speakers for all sessions.
Yes,
organizers, please note. Soumya, please note.
Do that.
One question by Aftab Kasim. Why transgenders begin to have such different emotion? The question is to you, sir.
Okay. Actually, the thing is, it is not. I'm trying to say that actually, see, if we take myself and my woman colleague, we do have different emotions and different pattern of thinking. When I become a transgender, my emotion is totally shifted to a woman. So my way of thinking, my way of expectation, my way of expression, and how I want myself to be considered by others will be woman. And it is not a different one. Actually, I'll be very happy if I am totally considered as a woman. So why it is happening is actually it's my emotional requirements to express my pattern. As the cisgender people, what we are feeling, the same thing. For example, if I can more simplify, say I am a cisgender male, but if I am asked to internalize and behave like a woman, I'll find it difficult. The same thing I'll feel if I am going to be a transgender, I can only think, feel, and express as a woman, not as a man. That's what is the real situation of transgender, and that's why the Honorable Supreme Court has asked us to ensure their comfort.
Thank you, sir. Another question is, when should asexuality be separated from low libido, and when should it be considered a problem, and when should it just be considered another LGBTQIA plus spectrum manifestation? Is the question clear, sir?
Okay, it's clear. Actually, sexuality, low libido is actually a relative term. Low libido, it should be either to the person and also his partner, his or her regular partner. So, if there is a relationship issue arising out of lack of interest in sexual intercourse, which is expected by the partner or by self, if the person is feeling inadequate, then it can be a loss of libido. So that's why it is. That need not always be due to any LGBTQIA issues or anything like that. At this situation, we should say that actually is it secondary to any underlying diseases, underlying like medicines which they are telling, like diabetes, hypertension, and all, and you can protect it. Actually, in these situations also, there are measures through which we will be able to support the person. So libido as such, actually the sexual desire and activity is actually a very subjective phenomenon, which again, but the thing is that only when this is going to be reported, a doctor should be in a position to explain them that I understand your problem, and there is a way I can address it. Either the person can address, or he can refer the person to the right person from where it can be getting addressed. So many of these situations can be addressed. And LGBTQIA, again, I told you this: being a homosexual or bisexual is not going to be any disease. Actually, that is a person's preference for the most enjoyable sexual activity. They'll find that this is going to be the right partner for me. That again, so far as this is not going to hurt other people, that's so far as we are not going to insult any person's identity or sort of respect, this is not going to be a problem. A person can be a homosexual or bisexual, and provided their act should not do any harm to other persons.
Thank you, sir. Shilpa has commented about a practice which we usually come across. There are many cases reported of doctors requesting genital inspection of trans people who come to them with unrelated concerns like fever. Could Dr. Harikumar address this practice and explain why this is wrong?
Yes, actually, I'm happy that Dr. Shilpa has brought this, and brought this issue. And I think this should be in our group. This should be one resolution we should make. Actually, the thing is, one thing, the examination of genitalia is not required as far as it is going to be the concern of that person. If the person comes and says that I have some issues and some difficulties, something like that, which I want to get rectified, then of course there is a reason for examination. But to understand, to diagnose whether a person is transgender or not, doing a genital examination is absolutely not needed. Because I was trying to say that actually this is always with the mind, the person's emotion. And a person with all, and also we should understand that this SRF, so the surgery is not at all required for a person to become a transgender with all comfort and confidence. It is not. That is what we are trying to teach them. Many people fall into this sort of a confusion that if I have to become a transgender, then I have to undergo surgery. No, it is not needed. If you are confident, if your emotion is confidently to reach the gender where you want to reach, you are there, and that should be the sort of support the doctors should be giving. And I know many people. Actually, we are running many transgender projects in the state. There are many people who are there without any surgeries, who are very confident and very happy.
Thank you, sir. Sir, actually, we in our hospitals also, the questionnaire is a binary, either male or female. So that practice itself may have to change. We don't have a provision for others in the register.
And interestingly, the thing is that even this, if you go philosophically, if I say this binary thing is not violated. So when I become a trans woman, I become a woman. I see. I'll be very happy if I am considered a full-fledged woman. That's where actually that binary concept is still restored. That's what I feel.
Rajesh, there is somebody has raised their hands. Doctor, can you identify yourself and?
Yeah, I am Dr. Nisha Bhani, endocrinologist in Amrita Hospital.
Right.
Sir, I just wanted to, out of ignorance, I am asking because sometimes disorders of sexual development will come with gender incongruence. So first time before starting hormone replacement therapy, we would like to examine and make sure that there is no disorder of sexual development. So that's why we do we do that before starting hormone replacement therapy.
So, Doctor, see, my point was actually just to know whether the person is transgender or not. There are some people who say that actually the examination will give you some clue, which is wrong. What you told is a different one. Actually, I agree with you. And even the hormone replacement, hormone therapy, whether it is needed or not, is the first thing. Actually, we try to, before referring them to an endocrinologist, what we do, tell them is we explain them how the hormone replacement is going to affect their emotion also. And how that is going to be, what are the difficulties they are going to face, and also the bodily changes that is going to bring. And then, and actually, I'm telling it actually the behavior of the people in behavior sciences and psychiatry and endocrinology, plastic surgery, everybody should work hand in hand. See, all our views are correct. So in that situation, and also if the person wants to know about the reason for that, I was telling about, maybe you might have noticed what I was telling about the this homosexual population, that which is called ego dystonia. Ego dystonia is one situation where the person will be homosexual. I'll be very happy to be I'll be only happy to be with the male partner, but in between I get worried why I am like that. So in such situations, there can be some underlying medical reasons. So diagnosis, for making the diagnosis, we can convince the person and take the consent of the person with his support, with his consent, we can do it. But changing the transition, changing the person is not allowed as per the law also, you may be knowing. Actually, when actually a boy is brought by his parents and they asked me to convert him, the conversion therapy is against the legal thing. So these two, actually, we both are actually the one which I explained and the one which you are telling are different. In your what you are explaining, you think this is indicated. I understand that.
I hope Dr. Nisha, you are clear. Okay. And a question by Dr. Meena Adhikari: can transgender male after treatment be called a male?
See, thing is, that is what they desire, the person desires. And I personally feel that that should be done. But regarding the person, he's a woman who is converted into actually or changed to a man will not be able to do maybe all the functions or all the things like that. So there should be some limitation which is left behind. That understanding they should be having. But all the trans population, they want to be called, considered, and understood to the converted gender, which I think we should be doing it that also for the social, as a social what is your commitment. For example, when a trans woman, they used to have the female names by the names they call their colleagues, and now they enjoy it a lot. So also the men also.
Thank you, sir. This question is from a dermatologist, Dr. Jyoti. Jyoti, are you my classmate? I wonder. And we get many TGs for laser hair reduction treatments. All of them belong to lower socioeconomic status. Is there any reason for this? Is this issue not common in higher income groups? Sir, do you want to take this question? We have a session coming for in what is this? In the dermatology section.
Okay, maybe but the thing is that what I am trying to what I have felt is actually those who are in the affluent group, they can afford to become invisible, whereas those who are in the sort of low income group, for all the things they have to approach others and they become more visible at some situations. In our projects, actually the projects which are supporting them, we do have more people who are from the low socioeconomic category. Maybe the subsequent things, the more light should be thrown in that.
Thank you, sir. Dr. Meena asks, is there any currently comprehensive health insurance policy for transgender?
Our government of Kerala is trying to have this PG clinic in Kottayam Medical College, which we have started, and because of this COVID situation and all the issues and all, we could not take it the way we wanted. Again, we are trying to rebuild it, and the government, the Social Justice Department, is giving support, financial support for this surgery, this sex reassignment surgery. So these are the things which are there, but we need to streamline it and make it more comprehensive to be more friendly with the community.
Thank you, sir. Can a transgender adopt a child as of now legally?
See, now it is actually the Supreme Court verdict has given them all the opportunities. The thing is that now also in Tamil Nadu High Court, a verdict has come in favor of that. So still some debates are going on. So I think this is going to be through in another very short span of time, because most of the situation is in favor of them.
Is there any way to identify and differentiate between a pervert behavior and pansexuality? Pansexuality.
Okay, that's a good. The pansexuality. The thing is that I explained that. See, when a person's sexual desire, expression, or satisfaction cause trauma or ill treat to any other person, it's a perversion. Whatever it may be, even though it is going to be heterosexual behavior, if it is going to be harmful or undesirable to others, it is a pervert behavior. And if any act which is done through mutual conduct, this consent, and also not going to be harmful in the health way of any, it is going to be acceptable, but whatever it may be, because it is not that any one pattern is the right way of doing sex and all the other things are wrong. It is not like that. It is actually the consent, understanding, among adults also. It should not be among those people who are children. Pedophilia, which is a crime.
Thank you, sir. An anonymous attendee is asked a question. Is a gender dysphoria certificate mandatory for getting hormone replacement therapy? Can a person undergo HRT without having gender dysphoria, but just to have gender euphoria?
No, the thing is here actually we can. This is actually the decision of the treating doctor. What we are now doing or telling is actually before SRS and hormone replacement therapy, at least we say that it's 2 years. 2 years of continuous counseling, helping him to explore where do he or she stands, where do they want to go, what is going to be the sort of journey, what are all those issues should be explained well, and if again they are going to accept and take it up, then we can start the thing. It is going to be the choice of the person and the decision of the doctor. The doctor will decide whether this hormone therapy is not going to be in any way harmful for the person's health because of the other underlying issues, then they can go for hormone replacement therapy.
A related question. What about adolescents at the age of 15 to 16 who want hormone therapy, but parents are not willing to support financially with significant dysphoria?
This is a very good question. I should appreciate it. So the thing is, this is it actually. The thing is that a decision on sexuality, gender can be well taken only in an adult state. So if a person, if a child, if an adolescent boy or girl comes, it is the responsibility of the doctor to guide them through a process without discouraging or encouraging them, ensuring that at some maybe after some time you will be able to take a better decision. In between, nothing will happen, and we will be supporting you. So a good counseling will be required. And if they are facing any difficulties, we have to explore what are the difficulties under which they want to have this thing done as a desire. So if you guide them through a process up to 18 or 19 years, the person will have a natural decision making to either side. So at that point, whichever is going to be the side, we can support them medically. That should be the right way of doing it.
Thank you, sir. I think one more question is there. Could you please explain why there is a need for psychiatric approval to start HRT, and what all do they look for to approve the person for HRT? Is it just screening to see if the person is mentally sound to accept a life-changing treatment, or is it something to see if that person is trans enough to be approved? Is gender dysphoria a must thing for approval?
Actually, the thing is that I see all the gender dysphoria. 2-3 points I'll tell. See, all the gender dysphoria may not guide the person or take the person to a destination of gender transition. There are people with gender transition under proper guidance and support may at a later stage decide that I don't think that this is going to be my destination. But I am telling it actually conversion should not be considered. Again, in this hormone therapy also, when they are coming with a thing, first thing is actually we have to convince them where they are. That's the problem. So what is happening is actually I see that my peer person, my colleague, has undergone a breast reconstruction, and he looks very attractive. The thing is that whether that is going to be my long-term objective for what I want to have a change. So these are the things which the person will explain or will get an insight after 2 or 3 or even more sessions of counseling. So this counseling is going to be very important for that person. It is not just a talk. The person has to be taken through his emotions to a destination and enable him to think. At that point, if again you also the doctor also convinced it, and also there are some like when the surgery is done, there are things which are irreversible. You have to tell them complications. You have to tell them, and after that, whether it is going to be what are the things they are going to gain. All those things are actually explained. Still, if there is an intense desire for either of this treatment, then you can accept. So the thing is, it is not the severity of dysphoria. So even a highly dysphoric person may not go into a transgender population, maybe at a later stage. So these are always relative.
Thank you, sir. I think that was the last question. We had a wonderful interactive session. Thank you for enlightening. This is a truly enlightening experience for many doctors, and I wish the audience would share this information to all other doctor groups, so that we can have a more fruitful sessions in the coming days of this week. Thank you very much, sir.
Thank you. It was nice interacting with all of you. It was a good opportunity, and we'll try to do more things in this in the future also. Thank you very much.